This video is meant to explain the mechanism of pacemaker-mediated tachycardia, which is a reentrant arrhythmia that can occur in patients that have two things. They have to have a dual-chamber pacemaker, meaning a pacemaker with both an atrial lead and a ventricular lead, and they have to have intact retrograde avinodal conduction, meaning that a beat that originates in the ventricles is able to pass backward across the AV node and wind up in the atrium. And the reason for that will become apparent in a moment. How does this get started? Well, step one is a PVC. And if the PVC happens at an unfortunate time in the cardiac cycle, the AV node will be excitable. It will be recovered from whatever the previous beat was. And that allows for the PVC to conduct retrograde into the atrium. The atrial lead will see that there was an atrial event. It doesn't know that it was retrograde. It just sees electricity. It just knows that the atrium contracted. Now, imagine that you're a pacemaker. Most of the atrial activity you see is going to be either PACs or predominantly sinus. And so the pacemaker will expect that to be followed by a QRS. So it's going to search, see if it sees a QRS following that atrial event. But when it doesn't find one, what does it do? It paces. It thinks that the patient needs a heartbeat. So it delivers a pacing spike, and at this point, the AV node has recovered from the prior beat. So again, that paced beat is able to conduct retrograde and wind up back in the atrium. Atrial lead sees an atrial event. Pacemaker goes looking for a QRS to follow it, doesn't find one, delivers a pacing spike as a result. This arrhythmia can continue essentially indefinitely as an endless loop. Sometimes it's called endless loop tachycardia. There is one reliable way to stop it bedside, which is to place a magnet over the device. Magnets put the pacemaker into what's called asynchronous mode, where it just simply paces at a fixed rate no matter what's happening. And this terminates the tachycardia because there's no sensing. So steps 3 and 7 cannot occur because the pacer is just pacing at a constant rate no matter what. And here is an animation showing what that looks like sped up a little bit, the whole cycle.